Okay, so welcome to Skin to It. I'm Marlo Sutton, fashion stylist and skincare enthusiast.
And I'm Dr. Sandy Skotnicki, board certified dermatologist.
So today we have a very special guest, Dr. Dimitris Motakis. He is a renowned plastic surgeon. Sandy, I know you have a personal connection to today's topic.
Yeah, maybe we'll get into that. I did see the lovely Dr. Motakis for a consultation on a deep plane facelift, so we will
get into
chat
that. And
about that
I don't know if you know this, but I also, and you probably don't remember because you see so many people, but I also visited your office for a little consultation on actually a nose job revision.
Okay.
That I did when I was 19. So yeah.
I didn't know that. See, that's some of the fun parts about this is it's a conversation between two besties. And so I didn't know that.
We don't tell each other everything.
Not everything. I would like to take this moment to introduce our special guest today. Dr. Dimitris Motakis is a board-certified plastic surgeon who trained at McGill University with a subspecialty expertise in aesthetic and breast surgery. He is widely published in plastic surgery and he has been in practice for 16 years. And you can visit him at his new location on Avenue Road in Toronto, Ontario.
So if we can just kind of get right into it, we want to talk about the deep plane facelift, but let's talk facelifts in general. Facelifts in 2026. How about that to kind of just start us off?
Yeah, so there's been a significant change in the field, and I think more, as you can see from social media and different publications, the deep plane has sort of become a very popular word in the world of facelifting. Almost every patient that comes to see me says, "Is this going to be a deep plane facelift?" So the public is very educated about what's available to them, and I think that's really because of social media. Even though many surgeons still perform traditional facelifts, more and more surgeons are adopting the deep plane facelift because of the reason that, of course, the public wants it, and second, because it delivers much more natural results. I'm not sure if that answers the question.
Yeah, I mean, well, no, it kind of segues into like when you're doing a deep plane facelift, as compared to like, so you touched on a traditional facelift, which let's actually start there, which is the SMAS. And so maybe you can define that because again, the public is very knowledgeable, but I think if we asked, I mean, Marlo's very knowledgeable about a lot of these things. You don't know what SMAS means, right?
No, I didn't know what SMAS means.
Yeah, so let's define what a traditional facelift is where we lift the SMAS, which is, I think, more superficial. And then the deeper layers, like what layer are you actually lifting with a deep plane facelift? So let's kind of start there.
Yeah, so it helps to look at it a little bit historically. Like we started doing facelifts in the 1900s, 1907. People started lifting just skin. So first descriptions of, I mean, some of it may be speculative. There's no very good documentation, but we're talking about up to the 1970s, we were lifting just skin. And this is where the procedure got its bad reputation. Mm. We learned a lot from it and we wouldn't be here unless we, of course, started from there. Mm-hmm. But of course, we ended up with a lot of unfavorable scars, a distortion in the ear, what is known as a pixie ear, where the ear is pulling because of bad tension in that area. Mm-hmm. That pulled look got its reputation mainly from skin-only procedures. So in the 1970s, a surgeon known as Cook describes the SMAS. He actually performs a SMAS facelift without the actual description of the layer that was named and defined later in time. And what SMAS stands for is superficial musculo-aponeurotic system, which is a very fancy word to describe a layer that sits underneath our skin and superficial fat. So think of your face as made out of several layers. You have your skin, and then right underneath it, you have this padding, this fatty padding that's composed of little pockets of fat that gives contour and shape to your face. And we're talking about our cheek fat. That's an example of like that superficial fat that sits underneath our skin. Right under that, you have this structure that holds it all together, known as the SMAS. And it's, as I said, fibrous in some areas, sort of in the middle of the face, and then muscular in some other areas. So it encompasses this muscle around the eye, we call it the orbicularis, oculi, and the platysma, which is this wide, big muscle on the neck. Mm-hmm. So you have this sandwich of skin, fat, and SMAS that now is stuck on top of the underlying structures, the muscles of the face, if you will, and it's stuck down with specific anchors, what we call ligaments. So manipulation of the SMAS is what causes the tissues on top to move into their proper position. In the 70s, we started manipulating the SMAS without releasing those anchors. So we were basically sewing it together. There was different versions of a SMAS lift, and that's why there's not one universal SMAS procedure. You can sew it together, you can lift it partially and move it, you can lift it vertically. So there's a lot of different SMAS procedures in reality. It's not just one procedure, but they all have one common ground. They did not release the anchors that were holding that SMAS tissue down to its underlying muscles and structures. So in the 1990s, the deep plane is described by a plastic surgeon known as Hamra, but it's not popularized because of the fact that it was considered to be intricate. We're still experimenting with the SMAS lifts, and they were delivering good results. But later on, as we had more and more experience with the SMAS, as facial surgeons were failing to deliver results in more difficult faces, heavier faces, more aged faces. And as other surgeons that were experimenting with the deep plane were giving better results, it became more popularized. The description of the technique became better delineated, and more surgeons that were doing facelifts routinely adopted it.
Can I ask a question there? So just so I understand it from a doctor point of view, you're still in the same layer with a deep plane facelift, but you're just releasing all those ligaments.
You're advancing much more anterior towards the nose and the mouth, and you're releasing all the ligaments that are tethering that structure. So,
so you're not going below the SMAS.
You're not.
No. Okay.
That would damage important structures. So deep plane it's almost like a misnomer. You're not going deeper. You're going further, and you're doing more extensive dissection.
Right. So you're releasing. So actually, that's an important point. So when you go in, and I'm just saying for Marlo, but also for the guests, and I'm not the plastic surgeon, but you have to actually go and release everything, because they're all stuck together. So you're undermining more. Undermining is when you're releasing all those things, and you're releasing all those. That's why it doesn't pull as much, because it's all free. It's freely moving. Okay, so it's not a deeper layer. Well, there we go. We just explained it all.
Well, thank you very much.
Okay, done. Okay, we can leave now.
Right. So obviously that's why it's giving you a more natural look now that
because there's no tethering,
right? And is it also much longer lasting?
That's a good point.
Yes, because you have less chance of relapse. If the anchors are there, of course it depends. There's been a lot of the rage has been Kris Jenner. I mean, she had a traditional SMAS lift. That's the truth. By a surgeon that performs only SMAS lifts. Now, the procedure was not a complete failure. We didn't go through, 30, 40 years of complete failures. It worked in certain cases where rejuvenation, there were less aging changes. This is a person that's probably had 2 or 3 facelifts in the past. It's a sort of a pickup procedure for her, and it's a different sort of category, if you want, altogether. Now, so it's longer lasting. Yes, because you have release of those ligaments, everything is repositioned, and there's nothing that can actually pull the tissues back, if you will, because the anchors have not been released completely.
And I'm probably jumping around here, but how long should a deep plane facial last?
So there's 2 answers to that question. One, you will forever look younger. So a person that performs a deep plane facelift will forever look more youthful than if they haven't done it. So as long as you live, you're going to always look more youthful. So if you were to look at yourself 10 years down the road, and you were able to look at yourself without it, you could distinctly see that you look way younger. But you continue to age. The minute that we're done with the procedure, aging doesn't stop. So 10 years down the road, you will look somewhat more aged than when we did the procedure. So it's not inconceivable, if you're in good health, young and vibrant still, that you may want to touch it up and repeat the procedure to get the same kind of definition and sharpness that you had when you first had the procedure performed. So think 10, 15 years.
I actually wanted to make a point, and just because I've been told I'm good at explaining things to patients, and so I'm just thinking about the difference between a traditional facelift and the deep plane. So if you go to a doctor and have something cut out, right? Like let's say a mole, you don't cut a circle and then close it, because it would stick out, right? You think about that. You have a circle, you close it, it sticks out. So what we have to do when you're cutting out things is you have to undermine. So we release all the tissue, and first we cut it in an ellipse, and you release all the tissue like underneath so that you can move it.
Right.
Because otherwise, if you close something without releasing, like the skin is stuck on the lower tissues, you have to release all that, and then you can sew it and it's not pulling.
Okay.
So I'm understanding now with the
I think that's a perfect explanation.
yeah, because
Yes.
you have to release everything so it's not stuck, and then the space, the skin and the derma or the skin layer and a little bit of the fat layer, you can you can move it
It
easier
moves.
over the lower layers if you release all those ligaments that are pulling it. So
Correct.
that's why it doesn't look pulled. It's not about the level.
Yeah. And it's not just that. The incisions look better. In general, when there's tension-free closure of any skin incision,
Yeah.
the incisions look more imperceptible. Everything just looks like there's no tension in that area. And so it's a very good analogy that you used.
Yeah. Well, there you go. See, I was told I should have been a surgeon. Okay.
Yes.
We're at the who typically needs one, or what question did you want to ask?
I have a different question, but
Okay.
we'll get to all of it. So my mom, and I'm sure she won't mind me saying this on out here, did a facelift when she was 50. She's now 83. And her main concern was her neck. So she did a full facelift, but her neck, they couldn't really do the neck properly. And so, I mean, the question is the deep, like with a traditional SMAS facelift, was it less effective on the neck?
So very good question. So one of the main reasons that surgeons adopted, and myself adopted the deep plane, is exactly that reason. We're failing to deliver good contours in the neck. And the reason was twofold. Not sculpting the area underneath the neck appropriately.
Mm-hmm.
What is done now by a procedure known as the deep plane neck lift, which is a part of this procedure. So basically, we're actually not just lifting the skin and addressing the platysma, which is these two muscles. We're actually lifting the platysma and going underneath that area and sculpting the structures that creating fullness to get a permanently better contour in the jawline. But also releasing the ligaments that we talked about before allows a better shaping of the jawline. So the combination of those two elements of the deep plane definitely create a much more sturdy, sharp result. The results that we could not achieve before. So you get, for example, a woman or a man with a very full neck. If you did a traditional SMAS lift, you will fail. It may look good the first week, but the fullness and the lack of definition will remain forever.
I would imagine from a surgical point of view, that's a lot of undermining. So it would be much more technically difficult and it would take a lot more time.
Yes. So it depends on expertise, experience, and complexity. So definitely I'm in a simple young individual that has good structure, that has just sagging of their face, but doesn't have real fullness in the neck or significant jowling. That procedure will take no longer than a traditional SMAS lift would take. But if you have a heavy face, a male, someone with a larger face, for sure, the sculpting that undergoes underneath and deep structure of the neck can take a little bit longer. So it's case by case. It varies.
So let's get back a little bit because it's such a great topic and we can go off in tangents. But so you kind of
yeah. So
the age.
Let's talk age range. Let's talk how. I mean, you've been practicing a long time, like how it's evolved, younger, who's doing it, what's the average, those kind of questions.
Mm-hmm. Yeah, so it's changed also for two reasons. A deep plane facelift. So in earlier days, when a younger patient had some early aging change, will come and see us, we'll say, well, no, you're not ready yet, because we'll worry about relapse, or we're not going to be able to deliver a result that really would last and matter, that was significant enough. We were worrying about incisions not looking so great because they would pull in those areas. But with a deep plane, because we get full release and we have this free movement of the face, on a younger patient that has enough aging changes, we don't hesitate to proceed because we know they're going to look young, the incisions will look imperceptible, and they're going to look good. Now, the average patient that comes and has this procedure done is in their 50s and 60s, mid-50s, let's say. However, there's patients that either have lost a lot of age at a younger age. Now with GPL1s,
Right, okay,
for example, you have early 40s that have lost a lot of weight and their face has now sort of fallen. And genetically, some people just are not as advantaged. They have earlier signs of aging. They have heavier necks, very non-sharp jawlines, and there's no way of improving that non-surgically. Even though we have great non-surgical tools, they just don't work very well in the jawline and the neck. So if a patient comes with significant aging on the neck and jawline, then it's a go for me. And that can happen anywhere between the mid-40s, very rarely the early 40s. It's very rare, but mid-40s all the way to the late 70s, of course, when patients are more aged and, of course, are candidates.
On that note, if you don't, doing a second one, because scar tissue, if you're undermining more, is there more of an issue with doing a second facelift that's in the deep plane?
So I perform a lot of secondaries and tertiary facelifts on patients that I had it done. I'm now long enough in practice to see my patients from 16 years ago for their redos. And I've seen patients that had their surgeries done much earlier. I have not found that to be difficult, whether they had a SMAS lift. It's very rare. The only time that I've had difficulties if they've used some surgeons used energy devices internally that have caused internal scar tissue. It makes it a little bit more technically challenging, but it doesn't compromise the outcome. It just may take a little bit longer.
What do you mean by that? Would that be like ultrasound skin tightening or wave technology?
No, I have not found any difficulty with fillers, injectables, or external devices. So even though there's reports of therapy or Morpheus giving, I have not found that to be the case. We actually have a publication that has looked at fillers in surgery, and that has not shown to, empirically I haven't found that to be the case, and now statistically we have found there's no difference in outcomes.
So I think that's an important point,
yes,
because that was one of our questions. So just to repeat that, listeners, fillers, whether they're traditional hyaluronic acid, biostimulants, even radius, they don't seem to be a problem, and you can have a deep plane facelift after you've had them, and skin tightening things like ultrasound, radio frequency.
I have not found any difficulty with healing or anything of that sort. Now, it is possible. So the device I'm talking about is things that are internal, like FaceTight, for example, where you actually use a rod to heat the skin internally to cause contraction. Those devices were used to cause tightening of the tissue internally. I actually own that device myself. I use it for other reasons, but it was used to compensate for the lack of sculpting that was happening prior with earlier procedures like the SMAS lift. Okay, and that failed. It just left people with some scar tissue in the area that you can deal with surgically if you know the anatomy very well.
I don't know. I'm not sure of that machine.
It's the surgical component of the Morpheus state. So the Morpheus state is basically deploys radio frequency through the skin with needles. There's a lot of other RF technologies, but there are devices which deploy RF internally through a tiny rod to heat the dermis intradermally, if you will, or subcutaneously, to cause direct heating of the dermis and contraction. So it's the surgical counterpart of Morpheus 8, if you will.
So that one, you have seen potential issues with doing a facelift after that, because there's probably some scarring. Scarring there. Okay.
So, I mean, I guess maybe to close up the age range, are women or men doing facelifts preventatively, like really young? And what about I've heard of the ponytail facelift. Is that?
So I do not believe in preventative facelifts.
Mm-hmm. Good.
If a patient comes and is not in need of a facelift, I tell them to go enjoy their lives and enjoy their youth and come back later. So the way it works, I determine if I think there's enough there from a surgical standpoint to correct, where I feel I can deliver a good result. And then it is the patient's decision if they feel they're ready. It is the patient that will decide. You may be anatomically ready at 45, but psychologically you may not be ready till you're 55. And that's a valid point. It is, there's a lot of, it's not an easy decision for many patients. We can, say, yeah, it's a beautiful result. It's a very gratifying thing, but people have to think about it seriously. And I always tell the patient, you need to be psychologically and mentally ready to do this.
Yeah. I'm not.
Then after
I see this season and my jawline, I might be okay.
Oh gosh.
So the next question I want to get to is complications. I mean, okay. So I hope the listeners have a great idea of the differences between the traditional and the deep plane. It's not about level. It's about what you're releasing. We got a great handle on age. So let's talk a little bit about complications. I mean, most of the complications, like I'm aware of, the one I don't know if I chatted with you about, but nerve damage often, like even patients will, when they ask me in passing about, I'm thinking about a facelift, but I'm worried about the anesthetic, I'm worried about nerve damage. Do you want to just give us the Cole's notes on, and I guess, the deep plane one?
Yeah, so there's common complications. Infections, healing complications are low rate, 1%. We think of hematomas, basically blood collection underneath the skin. That's with any surgical procedure. Thankfully, now we are using something called a hemostatic net. We don't use drains anymore, which tacks the skin down. We put these stitches that hold the skin down for a few days, and that has seemed to decrease the amount, the percent of hematomas, of bleeding complications that we get. And that has changed our practice quite a bit. So we don't worry about that complication as much anymore. And in terms of nerve damage, I haven't found a difference there's no, the risk of permanent nerve damage is extremely low. I mean, in the literature, you see it 1 in 1,000. I haven't had any of these cases, and I haven't heard any of my colleagues having to deal with them. You have to have very good knowledge of the anatomy, and we avoid using sharp instrumentation from a technical perspective around the nerves. So we use something called blunt dissection. We actually are very gentle in that area to avoid harming the nerves. So there are technical things that we do to warn us when we're close to a nerve. So we have warnings. Even from a technical perspective, we use something electrocautery to sort of be able to stop bleeding, but it also gives us at a low level warning signs that we're getting close to territory. So even if we know the anatomy, even if we know the roadmap, we have sort of a backup approach that warns us when we're getting close to a structure of importance, such as a nerve. So I haven't found that to be an issue. You can have temporary weakness. So because of the swelling, because of the extensive dissection, you could have a temporary weakness of a nerve, and that's not uncommon. You will see it 2-3% of the time, but that resolves after a few weeks. It's due to swelling, and that comes back. Okay.
Right. And so what's the recovery time? Like, when are you really going back to work or going back out in public?
Yeah, so it depends. If you have a young person who's just had a deep plane face and neck lift, recovery can be as quick as 2 weeks, where you can actually go back in the public eye and not have to worry with your hair down. Of course, you're not going to do a ponytail. The incisions take a little bit longer to fade away, but with some makeup, your hair down, you're presentable. Now, if other procedures are tagged along, and this is a very common thing, patients will come and resurface their skin.
Yeah.
They may have more extensive neck work done. They may have more swelling underneath the neck. They may do their eyelids at the same time. That, of course, compounds the recovery. So now you're looking at adding another week of recovery, maybe even feeling not like great up to a month. So it really is case by case. I call 1 month a graduation day. At 1 month, patients are basically back to their normal life with no limitations. They can travel, swim, exercise, and there's going to be things that still have to resolve themselves, such as the numbness. The numbness, the lack of sensation will resolve over a few more months. The incisions will fade away over a few more months. The stiffness they may feel, that will also resolve over a few more months, but they're presentable and look very good at usually a 3 to 4 week mark.
Yeah, so that was also part of our questions is, so the different things people do, like, kind of like, well, since I'm going under, right, I might as well, like you just said,
do my eyes,
resurfacing.
do my neck.
And so is it, so a couple of things, like, what are people doing? Like, what are the most, you kind of touched on it, but if you could maybe explain a little bit more what people are doing while they're also doing their deep plane facelift. And is the brow lift part of the facelift, or is that like a separate thing?
And so think of it as I sort of divide it into the lower face and the upper face. So a deep plane face and neck lift really addresses the lower face, from the cheekbone down, from the eyelids down, all the way to the neck. The upper face includes 3 procedures, really: your upper eyelids, your lower eyelids, and your brow lift. The face ages pretty much universally. We notice some areas more than others, but it's not like your eyelids are holding back and your face is falling down. Of course, some areas are more noticeable than others, but very often, especially if a patient comes to see me later, let's say in their late 60s, there's other findings. Their eyelids have drooped. They may have bags under the eyes. Their brows have fallen. So they may choose to sort of address the rejuvenation, their facial rejuvenation, more holistically. And the truth of the matter is those results can result in a more global rejuvenation where everything is sort of addressed. Every aging process that happens in the face is addressed. So that looks more uniform. It's 50-50. So procedures, so the brow lift, to answer your question, is not part of a deep plane lift. It addresses really brow position. Nowadays, we do this endoscopically. There's 2 little incisions that go in the hair that allows us to address the brow.
So I have two questions there. I think some of it, like if I was just looking at my own consultation, some of it, like whether you do just the facelift or the eyes and the brow and the neck, it's cost. Let's like call out the elephant in the room.
100%.
Okay. The next
100%.
second thing is time, because you have to have more time off. With the plus is obviously get it all over with and
Get
you're
it
just
done.
done.
Yeah.
So I have on the downside, if you have somebody with other comorbidities, so they're an older patient that maybe has hypertension, or they have, I don't know, thyroid issue, they might have some issues healing. Would that factor in whether you do one procedure versus 3 procedures? I mean, as a physician, I would think it would. So
Yes. So definitely we screen our patients. So patients that are unhealthy or unfit for surgery are not, we don't perform the procedure on them. So if someone is diabetic, morbidly obese, if they have other health issues, we actually, we're not even allowed to do these in an out of hospital facility because of the risks. If the procedure is going to take long, the length of the procedure, so if there's extensive face and neck work done, definitely we don't want to extend that surgical time, and those will be sort of broken down into smaller procedures. So a young, petite lady with very little findings will be a very short procedure, but a male with a heavy neck and a larger face would take longer. So yes, that would enter the decision making, and things may be broken down into multiple procedures, over a period of time.
yeah, and I think you sort of alluded to it, but it's the perfect time to get, like, I just had resurfacing of my face. I had erbium or a halo laser, but a CO2 laser is really the gold standard for resurfacing. And I know a lot of patients do it when they're out, like because it hurts. But there's also the tissue healing. So have you ever had any problems with doing a CO2 laser, which is a resurfacing laser? I think everyone knows that. Because around the incision sites and things like that, what's your sort of, do you have people where you won't do that? Yeah.
Yeah. So in the past, when we used to perform SMAS lifts with the skin undermining, we would basically lift the first layer extensively to expose the underlying tissues and manipulate those tissues. You would worry because the tissue was so thin that you would worry that the laser would actually further damage the tissue. So I would hesitate. I would rarely perform extensive CO2, especially a full face CO2 resurfacing at the same time. With deep planes, things have changed dramatically. Because the tissue is a lot thicker, there's absolutely no hesitation.
So there you go.
And
so that's why
issue.
I think that's why a lot of people do it. So I think we're kind of wrapping it up here. Yeah.
Yeah. Just, I guess, a couple more maybe random questions, but when you're looking at, I guess, celebrities who've done work.
Yeah, you wanted to ask this, yeah.
Yeah, I guess, can you really tell right away what type of facelift they've done or what work they've done?
Well, he said Kris Jenner did a traditional. I thought that was interesting.
That was so interesting.
I thought she had a deep plane, but it's because she's had a couple already.
Yeah.
She did. So, and again, it's not like the SMAS lifts were useless or they didn't deliver result. It's just they failed routinely, especially in more complex cases. There are other disadvantages of healing complications that were greater with SMAS lifts. So it's not that procedure was useless. It's just that deep plane consistently deliver a more natural result in any type of face. It's an easy recovery and more natural look. So that's the idea here. It's not that what we did before was completely useless. There were good results in the past too.
And can I ask you a question? So if you have someone who's come to you a long time ago, did a SMAS facelift, and they don't like the results, are things like that fixable? Sometimes.
So, or to some extent, they're always fixable, but not maybe to the extent that I would want them to be fixable. So there's patients that have unfavorable incisions. Sometimes it's challenging to fix their incisions. They were placed in the wrong place. In terms of a surgical standpoint, yes, I can improve things with the deep plane. I've always taken those cases on, provided that the incisions are not in a completely unfavorable place. So if the hairline has been moved, I can move it back down. That's sort of done. And we have to work with that, but we can optimize the result in most cases.
So I just am going to sort of wrap it up from a dermatological point, and I'm sure you would agree with me that surgery is great, lifting, getting rid of shaping the jawline, raising the eyes, but that still doesn't take, you still need facial rejuvenation, or it doesn't affect texture, it doesn't affect color. So doing those other things along with the facial rejuvenation from a surgical point of view, I think is a 360 approach, which I think is great. So there's still a place for fillers. There's still a place for biostimulants, lasers, all that kind of stuff. And I'm seeing you nodding, so you're agreeing.
I
Yes.
agree. I agree.
And that's why you
100%.
practice with a wonderful, beautiful dermatologist, my old colleague,
Yes.
Dr. Salzberg. Yes.
Yes. And I've performed these procedures in the past, so I'm very familiar with them. And there's a lot of backlash with fillers nowadays, and it's just sort of
It's operator
depending
dependent.
on- yeah, it's operator dependent, and they all serve a role. They're complementary, not mutually exclusive, and that's what I tell the patients. So it's like cooking. You need a bit of salt and you need a little bit of pepper.
I like that. That's a good analogy.
So
yeah.
I'll give you the salt, but you'll need to get some other spices in there, and your skin health, rejuvenation, pores, wrinkles, volume loss, skin health, all those things have to be addressed. So the routine question is, will I need Botox after facelift? I'm like, of course you will. I'm going to bring you 10 years back. You needed it then. Why wouldn't you need it now?
Yeah.
They do different things. So yes, we go through that sort of discussion all the time to inform patients, this is not, I did the surgery and I'm done for life. That does not exist. It's like getting your dream body while you're working out and then saying, I'm done. You will continue to work out and work on your body. So maintenance is key.
There's actually a good point there. We did bring it up a little bit about GLP-1s, which is the, for the listeners who don't know, that's Ozempic and Wegovy. Those are the people that even after a facelift, if they have a lot of sagging, are going to need some sort of biostimulant or filler because they have lost some of those fat pads, those structures that are actually holding up their skin. So even if you pull the lower face, you're still going to need some filler. This topic, we could go on forever, but I want to thank you very much for helping us unpack this topic. Is there anything you want to add?
I mean, just as in general, just the people need to remember that aging is a complex process of sagging, volume loss, and skin changes, and all have to be addressed, as you mentioned before.
I want to add one thing.
Not just surgery.
Dr. Motakis practices at a brand new, beautiful location on Avenue Road, Avenue MD, along with a dermatologist, Dr. Jennifer Salzberg. So if you want to check him out, because he's excellent and he's been very good at unpacking this episode. Do you want to add anything?
Totally fascinating. I think people will really love this.
I think this is going to be a really well listened to episode.
Yeah.
You're going to get a lot of patience.
Thank you, guys.
You might be overrun. You might be overrun.
I have a feeling you're overrun already.
Yeah, probably. Yeah. So until next time.
It's a good problem.
Yes.
Thank you, guys. Thank you, Marla.
Thank you.
Sandy.
Thank you so much.
Catch us every Thursday for a fresh exclusive dose of Skin to It. And don't forget to subscribe so you never miss out on the skincare wisdom. We will guide you through the maze of skincare and cut through that noise to help you achieve your healthiest skin. Loving our podcast? Share your thoughts and help us grow by leaving a review on Spotify and Apple Podcasts. Until we meet again, see you soon on Skin to It, your guide to healthy skin.